Hello everyone, my name is Victor de Melo Soares and I'm currently a postgraduate student in the Oral Rehabilitation Program at the Ribeirão Preto Dental School, University of São Paulo. I'm a member of the NIMP group coordinated by Professor Andréa Cândido dos Reis, and I am under the advisement of Professor Mariana Lima da Costa Valente. Today, I will be presenting a paper entitled The Oxygen Inhibition in Polymerization of 3D Printed Dental Resins, a systematic review of in vitro studies. So before the adventure of the computer-aided design and computer-aided manufacturing, the CAD/CAM technology, dental prostheses were made using manually manipulated polymethyl-methacrylated resins. Nowadays, in additive manufacturing, digital coordinators guide a layer-by-layer deposition of photopolymerizable materials, minimizing waste through the solidification of this material upon the exposure to ultraviolet light. After the printing process, additional polymerization in controlled lighted chambers enhances the degree of conversion of the material, improving its physical and mechanical properties as well as the biocompatibility. So the PMMA photopolymerization occurs when through the UV light exposition, photoinitiator units release free radicals that induce monomer cross-linking, forming the polymer chains. However, about 30 to 45% of the double bonds remain unconverted, limiting the degree of this conversion. It's known that the free radicals preferentially bind to oxygen over monomers, forming peroxy radicals. However, this peroxy radical formation hind the polymer conversion and lower the degree of conversion. So oxygen interactions with photoinitiator units delay polymerizations and shorten photoinitiator units lifespan. In the light of this above, the systematic review investigated whether the oxygen inhibitions during the polymerization benefits the physical and the mechanical performances of the PMMA-based printed resins. First, this systematic review followed the PRISMA guidelines and was registered with the Open Science Framework. The literature research was conducted using the PICO strategies in 5 databases and 2 non-peer-reviewed databases. After the selection by the inclusion and exclusion criteria, the risk of bias was evaluated based on the Rob de Met 2. 2 authors individually assessed all these phases. And after the stages of inclusion, 11 articles were available for inclusion in the systematic review. The risk of bias highlighted the absence of randomization, blindness, and the justification for the specimen's size in these studies. The oxygen inhibition methods varied in different methods, including the glycerin immersions, the vacuum atmosphere, nitrogen atmosphere, and water immersion. All these polymerization strategies were positive for inhibiting the oxygen inhibition layer and increasing the degree of conversion of these 3D printed specimens. As expected, the oxygen inhibition strategies positively influenced the physical and the mechanical properties of the 3D printed resins. These oxygen inhibition methods differed beyond the strategy. Differences were also observed in the post-curing time, the resins or the equipment used, the printing and post-printing processes parameters used for 3D printing of these specimens, and the methods used for the properties analysis. The results found can be explained by the greater disposition among free radicals and monomers, which led to a higher degree of conversion and impacts the physical and mechanical properties of this material. As mentioned before, as conclusion, oxygen inhibition allows a higher degree of conversion by eliminating the influence of oxygen and free radical reaction. There are different polymerization strategies, and the methodological differences among the 11 studies included in this systematic review prevent a consensus on the best method to be used by the clinicians. CAD/CAM technologies can be improved by additional polymerization strategies, such as the oxygen inhibition methods, and even be associated with other methods as heating. So I shared the reference of the published study, and I would like to thank you for your time and for your attention. And I am also grateful for the opportunity to present this work for you and for the any valuable comments or suggestions that I know that will be kind. Thank you so much.